Good afternoon, everyone. Thank you so much for joining today's conversation about the early childhood self-assessment tool for shelters. As folks trickle in, I'll go ahead and get us started and get through our housekeeping and introductions for today. First of all, thank you so much for joining this conversation. We're so glad that you chose to spend your time with us this afternoon. For those of you who aren't familiar with Zoom, just a few housekeeping reminders. This webinar will last 1 hour. Audio is muted for all attendees, and we encourage you to ask any questions or share any examples of how you're implementing this work in the Q&A box. And we'll be sure to monitor that throughout, and we have time set aside a little bit later in the discussion to turn to your questions for our presenters. We are recording this session, and the recording will be on our archived webinars page at schoolhouseconnection.org. And you will receive a follow-up email after today's webinar with the recording and any additional resources. Just by way of introduction, my name is Erin Patterson. I'm the Director of Education Initiatives with SchoolHouse Connection. And if you're not familiar with SchoolHouse, we are a national nonprofit organization, and we're committed to overcoming homelessness through education. And we're very intentional about saying that because research shows that the more education a person is able to attain, the less likely they are to experience or continue experiencing homelessness. And it's also a recognition of the fact that schools and early childhood programs are often the first and sometimes the only place where children and their families are seen and identified as experiencing homelessness and connected to really critical supports. You can find us on the internet at schoolhouseconnection.org. We also encourage you to check out our Facebook group. That's a group of a couple thousand practitioners across the country, many school district liaisons and early childhood professionals who are deeply engaged in this work. We also engage in federal and state policy advocacy, offer practical assistance to communities and school districts. And we always say the jewel in our crown is our network of young scholars who are pursuing their higher education as well. Just a little bit of background about what brings us to this issue today. I do always love this slide with this photo. This is the best part of my job, is doing this early childhood work and getting to see these beautiful babies. There are 1.3 million babies, toddlers, and young children under the age of 6 experiencing homelessness in the US. That number is the most recent data we have available from the 2018 to 2019 state profiles that the US Department of Education puts out. You can imagine that that number has likely increased since COVID. 44% of young women aged 18 to 25 and 18% of young men experiencing homelessness are current or expectant parents to over 1.1 million young children. And so that's an important factor to keep in mind when we're thinking about serving children experiencing homelessness and a 2-generational approach to make sure we're reaching their families as well. Infancy is the period of life when a person is most at risk of living in a homeless shelter. And that's why I'm so glad we're able to pull in our experts here today to talk about that intersection and how they are reaching shelters to make some changes. And what we always say at Schoolhouse is that homelessness is more than a housing problem. It has a negative impact on child development, and families experiencing homelessness face multiple barriers to accessing early childhood programs that can provide comprehensive support. And so with that, I'm so excited to turn today to our 2 expert presenters. Excuse my screen, it's going a little crazy here. First, we'll hear from Beth Bordeaux, who is the co-owner of Partners for Impact in North Carolina, and then Sarah Vrabic with the People's Emergency Center. They'll offer an introduction to their work and how they have come about using the shelter assessment tool. And then I'll come back in and I have a few questions for them that we'll work through, and then we'll turn to your questions in the audience today. So with that, Beth, I'm going to turn it over to you.
Thank you, Erin.
Beth, I think you're muted if you're able to unmute.
Okay, there we go. It said the host had muted me. Okay, thank you so much, Erin, for inviting us here to share with this community about the work that we've been doing and about the impact on homelessness for young children and how we can make some movement, right? How we can move the needle on strengthening services that are being provided. So I'm the founder and co-owner of Partners for Impact, where we believe that systems don't always provide all people with the same opportunities. And so we work very hard to make systems change. And we know that systems change work can't be done alone. We know that we have to do that in partnerships. We have a team of folks at Partners for Impact that are human service professionals. We have individuals that have been executive directors and shelter managers, as well as social workers and human service program and system level evaluators on our team. And this particular project that we're going to talk about today, we were hired by Child Care Services Association through a preschool development grant to work with shelters across North Carolina and helping to implement the early childhood self-assessment tool to strengthen their support for young children that are experiencing homelessness. So we provide technical assistance and guidance with the shelters that we're working with. We have worked to build a community of practice across all of the different shelter programs that are involved in the project. We work to ensure that they have local connections with their early childhood community, and just connecting with the various different players in the community. Many of them already have those connections. Many of them had connections well before COVID, but then during the pandemic, where they've had to literally lock down their shelters, not let visitors come in, a lot of those programs and services and projects that they had going on, they no longer have been able to keep them up during this time frame. So now trying to figure out how to do that in a new way, how to change the way they operate in order to bring those services back and strengthen that. We're also evaluating our process. So it's not just working with the shelters, we're also doing a process evaluation at the same time. So we're listening to shelter staff and the folks that we're working with, and we're constantly getting their feedback along the way of how the process is working for them, what barriers they're running into, even in completing the assessment tool, even in trying to, to do the work internally. We're talking to them about that kind of thing. We're also listening to ourselves, right? We're listening to our own experience and documenting throughout the process as we try to engage shelters and as we try to engage larger community partners. And through that process, we will eventually be putting together a toolkit of sort of best practices around how communities can implement this tool in their shelters, how shelters can work together to build a community of practice, what kind of supports shelters need to be able to do this. Particularly shelters in various different areas, right? We're working in rural areas and we're working in urban areas. So how does that mix impact the work? So that's what we're doing. We're creating this toolkit, and then that's going to be kind of the project is a 3-year-long project. There's an additional add-on that we're just starting this year that's a couple of years long, where we're working with 2 community level groups. So we'll be actually taking the work that we're doing at the shelter level, and we're elevating it and saying, okay, from a systems perspective, how can we look at where the barriers are and the challenges to create a plan around better integrating the service systems from the early childhood service system and the homeless service system. So that's the kind of the next level of the work that we're doing.
Thank you so much for sharing, Beth. And I look forward to digging a little deeper in a few minutes. And I want to turn to Sarah now to introduce yourself and your work.
Thank you. I'm so happy to be here with you today. This is going to be a really great discussion. Hi, everyone. I'm Sarah Vrabic. I'm the project manager for the Everyday Learning Play Spaces initiative at People's Emergency Center, which is a nonprofit in West Philadelphia. And the project that I'm currently managing was actually informed and developed by our self-assessment work in Philadelphia, and I'll get a little more into that later. But prior to this role, I was an early childhood education specialist with the Bell Project at PEC. And the Bell Project has 2 main goals. It's to increase the developmental friendliness of housing environments for families experiencing homelessness, and to increase the enrollment of children birth through 5 utilizing those emergency and transitional housing programs into high quality early childhood education. So I have been involved with the Bell Project since 2016, since it first began. And part of the ways that we accomplished these goals was to conduct the self-assessment on a regular basis with the housing programs that we partnered with. So we've actually been conducting the self-assessment tool with a number of different emergency and transitional housing programs for 6 years now. And we've learned a lot through that process. We've obviously evolved through the pandemic. And I'm excited to share today how we have been able to consistently do that work over the past 6 years, what we've learned through that work, the kinds of changes that we've seen in the systems in Philadelphia. So we're going to get into all of that in our discussion today, but I'm very happy to be here with you all.
Awesome. Well, let's dig in if you all are ready. Before we get into some of the more tactical mechanical pieces, I know you've both sort of alluded to what led you to do this shelter assessment tool, but I wonder if we could start there. And maybe Beth, we'll start with you if you want to share a little bit more about how you came to the decision that this was the right choice to use. And then Sarah, will turn to you.
Well, I have to start with Child Care Services Association, and actually Marcia Baslow who's the CEO of Child Care Services Association, was very instrumental in the development of this tool. And, after watching it in action, she really wanted to bring it to North Carolina. So I think, kind of her leadership in our state around elevating the issues of young children experiencing homelessness, this was just one more step in that statewide leadership that she has taken on, and has really tried to elevate this issue to where people are starting to recognize, right, that when a family is homeless, oh my goodness, that means the child too, right? In North Carolina, you stated those numbers nationally, but in North Carolina, in that same 1819 year, there were 32,000, a little over 32,000 children under 6 that were experiencing homelessness. And the Department of Education estimated that 92% of those children were not involved in Head Start or McKinney-Vento programs, right? So, we know in North Carolina, we've got a lot of work to do to get these children connected to the resources that they need. It just makes sense too that you pay attention to a generational approach to working with families when they're experiencing homelessness, because it's not families with children. It's not that focus, although oftentimes that's how shelters focus, on families with children, but it's really families and children. Right. And so if we don't start focusing on the needs of the young children, and while we have this opportunity, while they're there, there's just an opportunity to connect there. And I think the other thing I would say is, having been a shelter executive director myself, having worked in a family shelter, I would say I've always wanted to elevate this issue. And I've always wanted to make sure that we were doing something to improve and strengthen the work that we could do for children. I just want folks to imagine for a minute, because I'm not sure exactly where our audience is coming from, right? If we're coming from the field where you're working with families that are experiencing homelessness, this might not be outside of your, thought process. But if you're not, I want you to imagine for a minute a mom with 3 kids. 2 of them are under 6. And if she and her kids are sleeping in the car at night, where do they park? How does she sleep? Right? Because she's got to constantly be awake and listening for anyone who might come up to the car, right? During the day, where do they go? If one child is like 10 months old, and another child is 3. where does that 10-month-old get on the ground to play? Like, where do they have a safe place to even learn how to crawl? If she spends her day in a park, then, I mean, I have a grandson right now who's around that age. Everything goes in the mouth, right? Where does she put the child down every day? So those things come to mind of how does a family actually manage having young children and experiencing homelessness. And once they get to the shelter, there's just such a huge opportunity, right? To provide a release and a relief for the intensity that that family has felt over the season when they were literally homeless. And then also to provide some support and guidance for the next phase when they move out of the shelter. And maybe you don't have as much connection and you don't have as many, people in their life that can provide that hands-on support. So there's just a sweet spot opportunity when families are in the shelter that we can do this work.
Thank you so much for sharing that. Sarah, would love to hear from your perspective, what led you all to this tool?
Sure. Beth, thank you for painting that picture. That was excellent. And I couldn't agree more. I'm so glad that you shared those stats in the beginning, Erin, because I was going to mention that as well, that you are most likely to find yourself experiencing homelessness as a young child. And it is such a critical period of development that we really need anyone who's in this work, who's advocating for young children experiencing homelessness. We need to make sure that the environments that these children interact with have the supports and the resources necessary to maintain that healthy trajectory of development. So I'll give a little bit of background of how we started this work in Philadelphia. There was a wonderful researcher, Stacy Perlman, who caught wind of this tool, and it completely aligned with her passions and with her work. And she started working with her PhD candidate at the time, Dr. Sarah Shaw, who's now with Chapin Hall, to implement this work in Philadelphia. And unfortunately, Stacy passed before the proposal could really get underway. It was very unexpected, but a wonderful group of colleagues that she had been working with kind of surrounded the work and said, we're not going to let this fall by the wayside. We are going to continue this because it's impactful work, it's meaningful, and it's what she would have wanted. So they started the Bell Project, which I mentioned in the beginning. And at the time, I had been working with one of those colleagues, Dr. Jeanette Herbers, for my master's thesis. And I heard about this opportunity, and I knew that it was exactly what I wanted to do, the kind of work that I wanted to do. So I've basically been doing it ever since. And we relied heavily in the beginning on the expertise of Marcia Baslow and Dr. Grace Whitney, who, like Beth said, were instrumental in developing this tool and really getting it out there for people to use. So that was the start of the work. In the beginning, we were funded by the William Penn Foundation to partner with emergency and transitional housing programs in Philadelphia, to build relationships with them, which we're going to get into today throughout the discussion, and to implement this tool with them, knowing that we had funds to make improvements based on what was reflected in the tool. What kind of gaps were there in providing services? What did the shelters need to better serve young children and to better serve the families of those young children? So we were able to fund improvements in the beginning, and the work has evolved since then. And I think with each question, I can share a little more detail throughout today, but that was the start of the work for us, and we have continued ever since.
That's great. Thank you so much. With this next question, I want to get into what I think a lot of people are anticipating, which is starting to talk about the changes that have resulted and what actually the shelter assessment tool has helped improve or helped change. And so, Beth, we'll go back to you first for this one, and then to Sarah. What changes in practice have you seen as a result of using this tool?
So we've only been doing it for a year, so so Sarah's going to have a lot more depth, in looking at longer term changes, especially as shelters have done the work year after year. So I think that is a critical thing to mention right now, is that this is something that needs to move from one year to the next, right, and continue to build on what you did in the prior year. So, and we're only working with 4 shelters from year 1, and we're adding 2 more shelters in year 2 right now. So our year 1 shelters, there's a few key things that I can say have already very quickly bubbled to the top. So we've done a pre-test with them, but we haven't done our post-test. So we don't even have that. Everything is observational data at this point, and just out of our conversations. But through our community of practice, where the shelters come together at least quarterly, sometimes more often than that, and they're sharing their experiences as they're working through the tool, as they're trying to wrestle with what things they want to make changes on and that kind of thing. One of the key things that has come up is space, right? How to design their space, how to work within the constraints of the space that they have in order to make it family friendly and child friendly. And it's not just about putting, outlet plugs in, right? It's about like really making this a child friendly space, like all of it, like not just thinking about what keeps the child safe, but what actually stimulates the child's development, right? How do you create a little space over here in this corner that has various different textures, and that that brings the ceiling down low and makes it a warm, cozy space, a place where a child can calm down when they're overexcited, or learning about how to not have every toy that you have spread out all over the room so that kids are overstimulated, but just about putting them away and figuring out where you're going to put the storage. And so all of that has been a really big deal and a big topic of conversation around how to design and create spaces. Everything from the actual rooms where families are sleeping and staying, to the common areas, we have 2 shelters that have actually created playrooms out of this. So that's been one of the manifestations of this, is like creating playrooms. One shelter is actually in process of planning for a new facility. So it has been incredible to hear them think through their process on planning the new facility and trying to actually design from scratch how they can make sure that they're addressing things in a way that they never would have thought to do had they not had this tool and been able to work through the different elements of it. And I think the other thing is learning the impact of having a staff member who is focused on young children, which is really hard to get because it costs money and there's not a lot of funding sources for it. It's not one of the HUD, it's not one of the HUD funded activities, right? So where do you get the money for that? Well, one shelter happens to have a person who just had an early childhood background. So they've been able to really elevate her role at the shelter and really kind of give her a lot of leeway in design work and in writing policy, and really taking this, the tool and the learnings from the tool to the next level, and then hoping to gain enough funding through that they can make a permanent position that is designated, and so that if this staff person moves, that they don't have to just fill it with, it's hard to find a social worker who also has an early childhood background, right? So finding the right fit, they want to dedicate a staff person to that. So that's another thing that's been happening. And if I can, I don't want to go too long, but I want to hit on one more thing, is that some of our shelters that we're working with are very low capacity. Some of the rural shelters have literally 1 or 2 staff. And so, it's really different to look at a shelter with a really low capacity like that and try to help them figure out what things they can actually accomplish within their capacity constraints, versus a shelter that has 30 staff, right? And more space. So that's just another one of the challenges that we've had to deal with as we're looking at changes and impact.
That's so helpful to hear. And Sarah, now turning to you from the rural setting to you are in more of an urban setting. I would love to hear what you're seeing in terms of changes in practice so far in this work.
Great. Yes, I'd love to share. So I will describe how we started this process in the beginning, and then kind of talk about the changes that have happened over time. So when we first started this work, we had funding, we had a wonderful grant. We had a partnership with the Office of Homeless Services in Philadelphia, which was very helpful because it's a name that all of the shelters recognized. It really established us. And we had team members, myself included, who had been working with families experiencing homelessness in the past with the specific shelters that we wanted to serve. So the foundation for relationship was already there, which definitely helped. And the model of conducting the tool was we would, come into the shelter, we would describe the tool, have multiple initial meetings if necessary to help build that relationship. And then very importantly, we would bring a staff member or some kind of liaison from a local high quality early childhood education program with us to the shelter to tour the space, and then as a group go through the self-assessment together, emphasizing there's no judgment. It's not a grade. No one higher up will be seeing the results of your assessment. It's merely to gain the expertise from someone who's in the early childhood field, allow them to make suggestions for how to improve the environment, and to ultimately build a relationship between that shelter and that ECE program, because we wanted to accomplish both Bell goals of improving the environment and increasing enrollment for young children experiencing homelessness through this one task. So it's been amazing for me as someone who's been a part of it since the beginning. And then, we received a grant from Vanguard to expand the Bell team, to expand our reach. We now are working with 29 emergency, transitional, and permanent supportive housing programs in Philadelphia. It's been amazing to see that growth over time. And I can say that one of the changes in practice we've witnessed is better relationships between housing programs and early childhood education programs. I work with one shelter where they didn't know that this high quality ECE was within walking distance of their program, but now they know. And staff from that ECE program have a table set up in the shelter once a week to help enroll new families. If a certain child from that program didn't show up at school that day, they have a staff member who just walks down to the shelter to check in on the family and see what's going on, how they can help. And that didn't exist beforehand. Now it does take dedicated staff in order to keep those relationships alive. And we all know that these systems are understaffed and under-resourced, but being able to be that intermediary to help bridge those systems has been an amazing change that we've witnessed over time. I have to, of course, mention just the physical improvements that have been able to be done in the space due to the self-assessment results. We've helped remodel a closet into a lactation space. Of course, funding toys and books and materials that we want to get used over time and experience wear and tear, just to be able to have the funds to replenish those things is huge. I also want to mention that just the overall shift in focus, like Beth was saying, on young children who are utilizing these services. It's not that they went completely unseen before, it's just there was no room in the system to really embed a focus on them. So it required this kind of intermediary, like I said, of the Bell Project to shine that spotlight and to keep advocating for this population of young children. And because we had a partnership with the Office of Homeless Services, the advocacy could be with them as well. So the passionate staff who kept wanting to have more of a focus on young kids within their shelter program had someone else in their court, but to use that phrase, to keep advocating for this population of kids. And something else that we have seen, which has been really nice, was through the self-assessment programs can identify what trainings they need, what trainings they haven't had in a while. And there's high turnover in our system. So you could have a staff person who has been there 8 months, but still hasn't received any kind of workshop on how homelessness can affect child development. So we were able to present, that list of trainings that people were seeking. And the Office of Homeless Services in Philadelphia actually added more trainings to their curriculum as a result of the self-assessment. So things like that are just amazing to see over time. So I think I'll stop there so we can keep going, but that's what we've noticed.
Thank you so much, Sarah. That's so helpful. I want to acknowledge that we have some questions coming in the Q&A box that I'll get to in just a moment, and encourage attendees to keep submitting those questions. And Sarah, you sort of opened us up to this topic of relationship building and trust building. And so I want to dig a little deeper on that. And Beth, would love to go to you to hear how you have been able to build those relationships between your shelters and the early childhood community where they might not have existed before, and what it takes to build that kind of trust.
Yes, so we started our project during the pandemic. And so all of our work has been virtual. We've not been out and visited the shelters. We've not been able to, we've gotten them to take their phones and give us a walkthrough. But we haven't been able to actually visit and be hands-on the same way that you have, Sarah. I'm a little jealous when I hear you talk about it. But we have done a lot of work on building relationships, and honestly, it started with just a lot of little phone calls, right? A lot of conversation and phone calls. We do have a one dedicated consultant who is spending time in conversation. She leaves messages or has conversation with folks at the shelter at least once a week, and has been, just staying in touch with them over time. So those check-in calls have been huge. There's been a lot of coaching, a lot of listening. We've even helped one shelter with a grant that didn't have anything to do with this project, just as a as a way of just helping to support them and support their capacity building in their shelter. Because as they build capacity, then they're more able to address the needs within this project. We initially started very differently than you guys did, Sarah. We started out with a self-led process, again, because we couldn't go out. So we started with, walking them through the tool, what it meant, kind of taking them through all the different aspects of it, and then allowing them to take it back to their teams and have their teams fill it out. We actually created an online version so that they could complete it, and we could pull all the data together and present it back to them, and they could see where everybody on the team agreed and everybody on the team disagreed, or we thought we were on opposite sides of this. And then we would come back to them with those results. Well, we found that worked really well with one of our 3 shelters. The other 3 shelters, we have, over time moved towards more of a, walking it through. We would schedule meetings, and for one shelter, we scheduled a meeting, and we literally got through it was a long meeting, but we got through the whole tool. For another shelter, or the other 2 shelters, we've scheduled multiple meetings where we'll go over this section of the tool, and then we'll come back later and go over this section. And then we meet with them one-on-one around developing their action plans and really strategizing on what they would like to change and how they might go about doing that. As far as building broader relationships across the community, a lot of that has been as a coaching model, right? And just kind of working with them and talking through with them what relationships they have, recognizing where there are gaps, bringing them contact information for other kinds of programs. And the other place where it's been is within that building the community of practice. That's probably been the strongest place for making those connections. And that is across the different shelter programs. So as the different shelter programs talk about the ways they're engaged in their community, then another shelter is going, oh, I didn't think about that. I can maybe reach out to, this organization or that organization and see if they can actually come into our shelter and do assessments instead of us trying to figure out how to do them. And so that kind of thing, there's been a lot of crossover across the different shelters. And what we've been doing as we build that community of practice is a lot of listening as we're on the ground with each shelter and listening to the things that we can elevate and bring into the meeting to help them to share with each other. So it's a lot of facilitating and a lot of listening. But sometimes, they're going to hear better from each other than they might hear from us coming in from the outside, right? It's not our community, but they're all living this right now. And so being able to share strategies and ideas on how they're doing those connections has been very, very helpful. And one last thing that I'll mention is that we've really taken an approach that this is not in contradiction to housing first models. So, there's early on, we heard some shelters talk about, that they were a housing first shelter. So they weren't sure that this work was going to fit for them. And so we've talked a lot about how this is a complement to housing first. It is not in contrast to housing first. Of course, we know that families need to move into housing as quickly as possible. But also, we have this sweet spot opportunity that I was talking about earlier, that we can actually help support families and children in a different way while they're here and before they move on, and then hopefully continuing after they've moved on because they've been more connected to the resources that they need in the community.
Thank you so much, Beth, for sharing that. That's super helpful. What an interesting point about being a complement to the housing first model. I think that's a really important point that you raised. And Sarah, I know you started to talk about this relationship building and trust building aspect of your work, but want to give you the opportunity to add any other details or expand on anything there.
Sure, definitely. I was alluding to the fact that we had a little bit of a foundation of trust already. I will say in the beginning, consistency is key. When we first started, Sarah Shaw and I met with the shelters very frequently, even just for coffee and for snacks. If you are first starting to build a relationship with the program, volunteering with them is a really great way to start that relationship. But like I said, consistency over time is key. All of us want to know that someone will be there for the long haul and not just, once and done. So maintaining that relationship over time is so important. And Beth was mentioning this too, but seeking first to understand the unique culture of that program, their unique needs, and how within a working relationship can we help meet those needs. So yes, we're going to do this assessment and we may have funds to help you, but it can be more than that. What can we connect you with? How can we deepen your relationships with other services in our city so that this program can be everything that you want it to be? And I think you called it a community of practice, Beth, but we have something very similar that my colleague Joe Willard started, which is called the Children's Work Group Early Childhood Conference that meets monthly. And it's a convening of basically anyone in the city who interacts with young children experiencing homelessness. So housing providers, early education providers, pediatricians, social workers, researchers, everyone coming together to talk about what's missing, where are the gaps, how can we better serve these young children. And the housing programs that we work with get a lot of support from those meetings and from that community. So it's connecting people to things like that as well. letting people know that you have resources to offer and just really continuing to listen, like Beth mentioned. Something that we did during the pandemic that my colleague Dawn Knock spearheaded was partnering with Lakeshore to create social-emotional kits based on age to give to the children in the shelters, because many of their childcare programs had closed during the pandemic and staff were desperate to find ways to stimulate these children, particularly because we have a lot of very large facilities in Philadelphia where the only safe way to mitigate the impact of COVID was to keep families in their unit 24/7. So you had families with 4 kids under 8 just in their unit all day long. So we listened to that need. We were able to partner with the reinvestment fund to get some funding and to give these huge, beautiful kits to each child staying in the program of different toys and activities that parents and older siblings could engage that young child with. And it didn't really solve any problems, but it helped. And that came through listening to the needs, just trying to keep strengthening that relationship so that it's way more than just assessing, if that makes sense.
That's wonderful to hear. Thank you so much, Sarah. I want to turn to our questions now from the audience. We have a few that have come in, and I think I can combine 2 of these to start. Want to ask you both to share how you identified shelters to participate in the assessment, and then did they receive funding, how much, and what were they allowed to spend that money on? So Beth, let's maybe start with you.
Sure. So our first round, we did research on shelters across the state, and we worked with the Emergency Solutions Grant Office at the state level to help us identify the shelters to participate. And so that was the first round. Second round, which is this year, we actually put out a request for interest, and we had a selection process based on that request for interest. In both rounds, we've been looking for shelters that had that did show interest in it, in the project, that we wanted at least one domestic violence shelter as well as HUD funded shelters. And I think we have one shelter that is not, it's more of a faith-based shelter. And so we wanted a diverse group of shelters. We wanted to be across the state. We wanted them in rural areas and in more urban areas. We wanted to make sure that there was a staff person who was going to be able to be our lead, to work with us and kind of, drive the process internally and be our primary contact person. So some of those kind of key things, but other than that, we were really very open to various different, types of shelters and shelter programs to work with. They did get, or they can get some mini grant funds up to $3,000. It may change each year, but that's what it was the first year. And so they can spend that on anything that is directly related to their action plan. So it can, the sky is really the limit. The action plan is related to the tool and the assessment that they did. But there's so many things that they can spend that on, from environments, which is what a lot of people are spending it on. A lot of shelter programs are spending it on environment, everything from redesigning a playroom, right? And all of like new furniture for it and lighting and things like that make it more child friendly, to mini refrigerators in rooms for families to keep food and that child friendly food, and also breast milk, things like that. To car seats and strollers. One of the things that we did encourage folks to not, we didn't tell them they couldn't, because everybody knows their community and what their access to resources are, but to really think through what resources can you get simply by asking, and what resources are going to be harder for you to get by asking, right? So if we ask our churches and our local, groups who make donations to shelters often, if we ask for a particular thing, what's easy for you to get? What's going to be harder for you to get? Those harder to get things are what we encourage folks to spend the dollars on.
That's great to hear. Sarah, same question.
Sure. So in the beginning, I feel like I have to name drop Joe Willard again. He started the children's work group. So we had, there were a lot of programs that utilized that work group every month. And that was part of the reason why they were selected to be a part of the pilot phase of using the assessment. Also, there was a network called the Family Service Provider Network that met often. That was a group of family service providers who were able to be a part of that first round as well. And I think what helped is that People's Emergency Center is itself a family housing program. So, we are the same as them in many ways, which helped to build relationships as well. And over time, we have grown. Like I mentioned, people start to see, this group has so many resources to offer. I would like my program to be a part of this work. So we've been able to add programs based on that and based on need. And I will say that something that we try to look for is if the staff has a capacity to participate in this kind of work. And we encourage the city to encourage shelters to have at least one staff person who is there and dedicated to the healthy development of young children and of all children there. That makes a huge difference in the work. And in terms of funding, in the beginning, we were very specific about funds being spent solely on the action plan, like Beth mentioned. But I will say over the years, some years we have funds to put towards the results of the self-assessment, and some years we don't. And in those years, staff still want to complete the tool because they want to be more aware of how their program is serving young kids. They want a regular kind of self-reflection on how well their program is serving young kids. And in the years that we don't have specific funds, that's when we try to supplement with other resources, bridging other relationships, filling gaps in other ways. I hope that answers the question.
I think so, very much. Thank you so much. This information is so helpful, and we do have another question that has come in. I want to stick on the funding piece if I could for just a moment though, because I think a lot of people are curious to know about the sustainability part of this. And Sarah, you and Beth both started to allude to this, that even when there aren't funds there to implement the results and recommendations, shelters are still invested. But I'm curious how you are both thinking about sustaining this work moving forward, particularly the funding piece, what those sources of funding might be, and anything else you can share. So maybe Sarah, let's stick with you to start, and then Beth will move to you.
Sure. So we definitely want the work to continue, and funding is a huge part of that. I will say that the tool can be used to help you with writing a proposal for funding. If you do a couple rounds of it, then you have evidence that you can include in a proposal, which is always helpful when you're trying to apply for a grant. I mentioned in the beginning that the current project I'm managing, Everyday Learning Play Spaces, we were able to receive funding for that project because of the years of self-assessment use we could present to the funders. So the current project, we're working with 11 housing programs to provide playful learning installations and child-friendly spaces designed by the families and staff themselves. So we really have spent the past year meeting with families, meeting with staff to understand their needs, their wants, and so that they could be the designer of the space. And then we work with architects to make those ideas come to life. And all of that was possible because of the work that we've been able to do with the self-assessment. So it can open a lot of doors. A future idea that we've been talking about at PEC is using this work to help open an operating foundation that is specifically to invest funds in young children in shelter and in the environments. It feels like there will always be a need for an intermediary to be bridging these systems. So let's accept that and see, where can we go with that knowledge and with that reality. So that's kind of a dream for the future, to have an operating foundation. But of course, we're always thinking about sustainability and funding.
That is really exciting to hear. I hope that maybe a year or two from now, we can have you back to talk about that operating foundation once it's up and running. That would be a great conversation. So Beth, on that sustainability and funding question, would love to hear your thoughts.
Well, I just got to say that's incredible, Sarah. So great. That's great. I hope that that does all come to fruition as you are planning. Well, so I mentioned earlier, there's this kind of second phase of the work that we're doing that's around system integration. We're working with 2 communities that we've just at the ground floor, just beginning that work right now. And is an additional grant through Z. Smith Reynolds that's helping to fund that process of. And so in these 2 communities, one is a very rural Western community in the mountains, and it's actually 4 counties, a 4-county region. And the other one is a more urban, kind of middle of the state area. And so in both of these communities, we are starting with a big kickoff process where we're bringing potential funders to the table. And potential influencers, not just funders, but who would be your strongest advocates that can help keep this moving? Who needs to be in the know, from county officials to school system folks to who needs to know? And so we're bringing those folks to the table for a kickoff meeting. And then as we go through our planning process and looking at our 2 systems and the discovery work that we do there, the listening sessions, and then coming back together and putting together a plan, then we'll be pulling those folks, those folks will already be in the know and they'll be connected. So hopefully there's a nice link there. We're actually putting in the process a sustainability plan as part of that process. Is once you come up with strategies that need to change in your community, things that you want to work on, then developing that sustainability plan. And since we've already made some of those connections up front, we may bring some of those folks into that conversation about helping to develop the sustainability plan. So we've got that very much on our mind at the forefront of that system level project. When we're working individually from shelter to shelter, it's more about how can that shelter take it to the next level, right? And we've been known to do a little research around local funders and kind of feed things, make connections, introduce people. We have talked with some of our shelters about how that action plan actually becomes a blueprint and actually becomes a fund development document that you can use. The content from that plan, both the looking at your assessment information and the notes from our assessment that we took right into the actual action plan and some of the key items in the action plan to paint a picture for what your shelter will be like as you've made these improvements, right? And so it, kind of helping them think through how they can do that and how they can make that ask, whether it be, a campaign where they're making that ask, that targeted campaign, or whether it's an ask to a foundation or another local funder. As far as Partners for Impact and Child Care Services Association, I would say, we would love to, especially as we develop this toolkit, it was never in our design to do this with 9 shelters and be done. Right? That was never our design. Our design was to kickstart something amazing. And so, we will work with these 9 shelters over this 3-year period, and we will develop this toolkit. And then hopefully we'll be able to scale that, right? So continuums of care that want to work with all of the shelters within their COC. This is a great opportunity, and Partners for Impact would love to come in and help support them in that process, right? And so, or those that feel like they can handle it, they have the resources, they just need some of the tools to be able to, make it a little easier. They don't have to create the process all on their own. It's already been created. They can have access to this toolkit. So there's various different ways in which we hope to see this process, continue on in the future. And I think there are many different funding opportunities for it once you have the concrete design of what you're trying to accomplish, and you have some of the data that Sarah has from the years that she's been doing this work is going to be instrumental in helping us all to move the needle forward, right? As well as what we've been doing here in North Carolina. So I'm just excited about where it can go.
Thank you so much. I love how you phrase that as thinking about the action plan as a blueprint for funding and sustainability. I think that's really powerful. And we have a few minutes left. And so I wonder if for your last words, if you could share any advice to our audience and participants who might be thinking about engaging in this work in their communities, where to start, and any advice that you would give them. And Sarah, let's start with you.
Sure. Thanks, Erin. I think my first piece of advice would be just to start, to look at the tool, whether you work at a housing program, an early learning program, wherever, to just start to read the tool. It itself contains so many different resources and information. So it's a great learning opportunity just in and of itself. And self-reflection will, I think, inherently spark new ideas and new ideas for connection. And then to start building relationships. And I think I mentioned before, volunteering is a good way to do that. If you've never set foot in a local shelter, then looking them up online, finding volunteer opportunities, and that will allow you to meet people from that program and start conversations. Funding always helps, but sometimes it's not there right when you're starting. So if there are opportunities for funding, that would really be a help. But I think building relationships and really just utilizing the tool and seeing where that can take you. I liked how Beth mentioned that the action plan could be a good way to gain funding, because the assessment is kind of an objective metric. So if maybe you're a staff person who has a challenging time with the leadership at your program in affecting change, if you do the tool with other staff members and you can show them this action plan, it can be a really great way to kind of kick off, these are the gaps in our program, this is the change that's necessary. So it can be a nice objective metric as well. I think that's my advice for now. I'm curious to hear Beth's advice as well.
I think the biggest thing I would say is take it slow, right? That this is a marathon, not a sprint. This is I think of like, this is changing your relationship with food. It's not a diet, right? And I think it's changing mindsets in shelter programs and in communities around around the needs of young children who are vulnerable and made vulnerable through systems, right? Through some of our systems. And so there is hands-on work to be done in shelters. There is big picture work to be done across systems. But as we shift our mindsets and say, there are things we can do at systems levels that can change the lives of children, and that we really can start ending homelessness. And as we work to end homelessness, we have to start thinking about the children, right? And so just take it slow, one step at a time. listen carefully, and do the thing you can do. I love what you said, Sarah. Let's just start. Just start. So, yeah.
That feels like the perfect note to end on. I want to thank both Sarah and Beth for giving your time and your thoughts and your experiences to us today. We'll remind our participants that we have been recording this conversation and it will be archived on our website. You'll also receive a follow-up email with the recording as well. Encourage you to reach out to Sarah and Beth. We can share their email addresses in that follow-up as well if they're okay with that. And please let us know what questions you have, or what, even better, what practices this has sparked that you hope to take into your communities. Thank you all so much. Have a wonderful afternoon.
Thank
Bye-bye.
you.